We started using OnControl in 2014, and since that time, we've converted all of our bone marrow and bone marrow biopsies to OnControl. When we started using OnControl, we didn't realize how easy bone biopsies could be. They're always challenging, especially in sclerotic bone, but when we have a power drill, they make them far easier, and we didn't realize how easy they could be until we tried OnControl. Bone biopsies are the most difficult biopsies we do often because it's the hardest tissue in the body. Other biopsies, we can use our hand power to get through a lesion, but bone is very, very difficult, so the power drill makes it significantly easier. Sometimes bone lesions are not on the proximal side of the bone in which we need to access, but are a little bit further away and deeper through the bone. With the OnControl system, the outer cannula allows us to drill through the front cortex and get to difficult lesions we may have not otherwise been able to get to. OnControl has changed our practice both for bone biopsies and bone marrow biopsies. For bone biopsies, we're doing more lesions that we were not able to do previously, and for bone marrow biopsies, we're getting much larger sample sizes than we used to. OnControl should be very familiar to any interventional radiologist because it's a standard coaxial system. You don't have to learn anything new. We can continue practicing just as the way we were before, but with better results. Patients do much better from this device than the manual method. Often we will have patients who had a manual biopsy previously in a doctor's office and then come to us, and when we do it with OnControl, they say it's completely different because they don't feel all the pushing and pressure from manual pressure because the drill just slides right in. Also, our pathologists have come back to us and told us how much better the biopsies are and how much more confident they feel about the diagnoses that they're making from our samples. I don't think I've ever met an interventional radiologist that tried OnControl and didn't immediately stop doing it any other way. It's just very easy to use.